Hello, and thank you so much for joining us today. I am your host, Denise Martinez, and today we will be speaking with Thea Willette for our People's Health Alliance of North America member series. Hi, Thea, how are you?
Good. How are you?
I'm doing well, thank you. And thank you so much for, being willing to be a part of the member directory and take the time to do this because I think the way in which we are going to be able to expand as an organization and as a group is to connect with other individuals, get the word out, and just grow from the ground up, in all
Mhm.
honesty.
It's like there's a spark within us, and once we realize, it's going to become a very intuitive process.
Yes.
And I mean, that explains how I came to this because I always think about myself 10 years from now, and I would have thought I was completely crazy. And even me trying to explain what I do and how I do it to myself 10 years ago, I wouldn't have listened to me. So it's like we need to experience have this experience which allows us to question and dig a little deeper. And that's such a personal journey that you can't shake people awake as much as I've tried. These
You're
people
absolutely
like
right.
you're going to have an experience and you're going to want to go deeper or you're not, and both are beautiful.
Yep.
And it's really just trusting that process and then holding that space for if and when it does happen.
You're absolutely right. And it is an individual journey, and we
Mhm.
all come to that moment um, at life when something happens.
Mhm.
And that what happens could be major or so
Mhm.
small, but it's all about
Mhm.
whether or not it awakens you and makes you
Mhm.
start questioning things.
Mhm.
And if it
Mhm.
doesn't, that's absolutely
Mhm.
fine.
Mhm.
Maybe you're not meant to on this journey and you're
Mhm.
meant to be that individual for somebody else to observe and
Mhm.
see so
Mhm.
that they can make the change in their journey.
Mhm.
And that's all right. It's all part of the process. We all
Mhm.
have to be willing to accept the
Mhm.
journey as it is
Mhm.
and be
Mhm.
open to it. And I
Mhm.
love how you
Mhm.
said that you wouldn't have even been able to explain to yourself 10 years
Mhm.
ago what you're doing
Mhm.
now, what it
Mhm.
means, or
Mhm.
how you came to it, but
Mhm.
you're here now.
Mhm.
And that's the beauty
Mhm.
of life. That's the
Mhm.
journey of life.
Mhm.
And
Mhm.
you are where you are.
Mhm.
So,
Mhm.
that being said, let's talk about this because you have a very interesting background.
Mhm.
You are a fertility specialist,
Mhm.
a quantum energy healer, right?
Mhm. Mhm.
And you're a mother
Mhm.
and you're a medical professional in the sense that you have experience
Mhm.
and got your education in that
Mhm.
field because you were an ultrasound technologist, correct?
Mhm. Mhm.
But
Correct.
you were specifically working in the sector of fertility to
Mhm.
start with.
Mhm.
So your journey, in all
Mhm.
honesty,
Mhm.
took you to where you needed to be to get
Mhm.
you to where you are now. And
Mhm.
I would love to hear about
Mhm.
that experience and what that
Mhm.
journey has been like for you,
Mhm.
Thea.
Hmm. Yeah, I mean, getting to the point of becoming an ultrasound tech at a women's health and fertility clinic, that happened very naturally and that was not planned, which I find is hilarious because I can see now why I took that path, but in the time I couldn't. In the time it was like, wow, this just works. I got into my program because I wanted one specialty, and then learning the specialties, I was like, oh no, ultrasound's way cooler. I'm going to go to ultrasound. So, like, I never even went into my medical program wanting ultrasound. It was like I learned about it. I was like, well, that's really cool. I'll go there. And then I started working in a general clinic, and I wasn't happy. I didn't how do I even explain it? I just felt like there was something missing. And it gave me a lot of experience. And then one of my friends, she worked at the Women's Health and Fertility Clinic. And she's like, Thea, it's so fun over here. Come work with us. And I was like, okay. So I went and I followed my friend and I was working there. And in terms of it was a job. I enjoyed it. I liked helping women, but it was still a job. And there was this part of me that just wanted to be a stay-at-home mom. That's all I wanted to be. So I had met my husband and we got married and we started trying right away to have kids. And it wasn't happening. And I kept being like, well, Thea, you work at a fertility clinic. Like, you know how this is supposed to work. Like, this can't not work. And it was just so much pressure that I put on myself. And like month after month, and we did have a miscarriage, which I wouldn't allow myself to recognize because it would have been classified as a chemical pregnancy, which kind of in the medical space is kind of like, you got pregnant, but it really wasn't a pregnancy and you'll get pregnant again. So it's kind of like you don't really take acknowledgement of it. So I never allowed myself to. I was like, happens to everyone. We'll get pregnant again. And month went by and we didn't get pregnant. And I realized that once I hit that 12 months of not having a successful pregnancy, of trying, we would hit that definition of infertile. And there was just part of me that I couldn't handle that. I couldn't handle the idea of that. So I just said to my husband at month 11, I was like, we're done. We're not trying. I totally believe we'll get pregnant when we're meant to get pregnant, but we're not going to try. Let's just take a break, just live for a year or two. Just,
Let it happen
can't keep
naturally.
trying. Pardon?
Let it happen naturally.
Yeah. And we got pregnant that month.
Look at
And
that.
I
What a
was like,
blessing.
interesting. Okay. Right. I'm like, well, I'll just enjoy this. Right.
Hmm.
And I did. And a really interesting thing that happened was because I worked in women's health and fertility, I see the worst of the worst. And the women that are coming to be monitored and coming for ultrasounds are the ones with complications and issues. So I get this bias of being surrounded, and the only pregnant women I see are the ones with complications. So you
Right.
kind of have this idea that they're just very prevalent. And as a way of trying to ward off that feeling, I had this like affirmation. I wouldn't even had acknowledged it as an affirmation. But when people would start telling me all this stuff that could happen to me, I'd be like, oh no, I asked for a low risk pregnancy, a quick delivery, and a sleeping baby. That would never happen for me. And I said it in such a joking tone that everyone would be like, oh, as if you could ask for that. And then like we'd kind of laugh along with it, but it was like my way of kind of sideswiping people, like almost trauma dumping their experiences on you, especially
Yeah.
working in that field. So I said this like repetitively for the whole like 9 months. Nope, I'm having a low risk pregnancy, a quick delivery, and a sleeping baby. And the funny thing is, at 20 weeks, I was diagnosed with a short cervix, and one of my doctors even said I needed to be on bed rest. Took it very seriously. And I mean, the beauty of my job was I got to work with some of the best doctors. Uh, but once again, I was like, nope, I'm having a low risk pregnancy, a quick delivery, and a sleeping baby. And then my cervix didn't change. They kind of downgraded it. They're like, you know what? It's really not that bad. Just take it easy. You don't have to be on full bed rest. We'll just take it week by week. And then week by week, it was fine. And it started elongating and it was no longer a risk of short-term labor. And I was like, whew, awesome. I ended up going overdue with my son. And I mean, there were so many. I can look back and I can see all the synchronicities that led to it. But long story short is we had a very quick labor. Like I was crowning on the drive to the hospital. My husband parked. We had to like run up. We were that crazy couple that ran in, and he was born 7 minutes after arriving at the hospital. And we were
Wow.
able to go home the next day. And
Quick
then
is right.
through a whole nother series, my mother-in-law had given me this book. And she's like, this book works for, all the women on this side of the family. I wanted to give it to you. And it was a sleep training book. And I read it and it resonated with me. And I implemented the protocol and it actually worked out really well. So by 6 weeks, my son was sleeping. By 12 weeks, he was doing 12-hour nights. He was sleeping incredibly. And it probably wasn't until he was about 6 months old where I was like, oh my gosh, I had a low risk pregnancy, a quick delivery, and a sleeping baby. I was like, how did that happen? Like,
You
I
created
joked
it.
about it, but how did it actually happen? And like, I had risk factors that would put me against that, but
Right.
somehow something happened and I got it. So that just kind of like resonated with me. I was like, interesting. And then when it came time to go have another baby, I got pregnant, had a miscarriage, got pregnant, had a miscarriage. And because I worked in the fertility realm, I have access, right, to doctors, to information, to treatment. So by the time I had had that second miscarriage, I had already told my boss, and she was like, Thea, go down and get some blood work, make sure that your blood work is checked throughout this. Actually, when I first got pregnant with my last miscarriage, they followed me with my blood work. And it was the lab who called me to say, Thea, your progesterone is dropping. You're going to miscarry this weekend. And I did. And that was really challenging. And so at this point now, my clinic knows, okay, I was having low progesterone, so I should supplement with progesterone. And they put me on a protocol and I started cycle monitoring through my clinic. And I did that first medicated cycle and everything looked like it was going to line up. Everything was looking good and it didn't happen. We didn't get pregnant. And it was just this emotional experience I couldn't explain. And at this time, also, I shouldn't say it all looked good because the truth was I wasn't even sleeping, like maybe 3 to 4 hours a night, if that. I was
Mm.
having massive anxiety. I was having like chest palpitations. I even went to emerge because I thought I was having a heart attack. Like there was just so many things that were happening, and like mentally and emotionally, I was so unstable. But physically, things looked good. My blood work was looking good. My follicle development was looking good. Like everything physically was lining up,
As
but
it
mentally
should.
and emotionally, I was so distraught. I couldn't even handle myself, and I was still having to
Wow.
work. Um, so it was just so when they came to me with the next idea for like, the next round of cycling, it was just as no, no, I can't. I'm not. I can't do this. There's got to be another way. And it was like this full surrender moment of, I just knew we were going to have more kids, but I knew this wasn't going to be the way it was going to happen. And how I knew that, I have no idea because I went the whole medical cycle. I saw what fertility had to offer. And I kid you not, within the next week, I like heard a talk and heard a talk, and I heard this gentleman say with conviction that every patient he had on a gluten-free, sugar-free, dairy-free diet would get pregnant within 3 months. And I remember saying to my husband, I don't even know what gluten is, but I'm going to get rid of it. And I'm going to cut it all out. And this was also the month of December. And I come from a dairy farm. So trying to explain to my mom in December that I can't have gluten, sugar, or dairy going into Christmas. And I mean, I grew up on a dairy farm. We put dairy in everything. And
She's like, who are you?
I know. She was like, what are you doing? I don't understand. Is this even safe? Um, anyways, we got pregnant that month. And once again, I'm like, whoa, like what is happening? And I mean, it's not to advocate that every woman needs to go on that diet. It's that there was this full surrender moment. There was this knowing we were going to get pregnant. And then the next week, the path that was meant for me showed up.
Yep.
Not only did that path show up, but it felt like peace and it felt attainable. And it worked. And I'm like, how is that possible? So then I would go
Mm.
on to spend that pregnancy, which was smoother than my first pregnancy. And I was like, I'm 3 years older. Like every time we see patients with subsequent pregnancies, there's more complications and they're more
Gets harder.
tired and everything is just worse or harder. And I'm like, this pregnancy feels like a breeze compared to my first one. And I was like, what is happening? And I mean, we'll kind of skip through some stuff. There's so many moments in there, but essentially my son is born and I'm still trying to figure this out. And I remember saying to my husband, I still don't understand what happened to me, but I'm going to figure it out. I want to figure out how I healed. I want to help women heal. And then within a week of saying that out loud to my
Your
husband,
husband.
my mother-in-law, and I think I said that to a friend. I came across a YouTube video of Richard Gordon talking about quantum touch. And it's this
Oh,
modality that we can all learn, and it taps into our intuitive, innate ability to heal, and that all healing is self-healing. And everything this gentleman said resonated. And I was like, that makes a lot of sense. Like, I need to learn more about this. And then, sure enough, there was an in-person workshop in my area on that one weekend I had in August that I had already asked some girlfriends if they wanted to get away for the weekend. Because I remember saying to my husband, I just need to get away. I just want to get away for a weekend. And sure enough, this workshop was on that weekend. And I go and I learn. And learning the modality of quantum touch is really fascinating because within the first 2 hours, you learn how to run the energy through your body. And once we
wow.
learned how to run the energy through our body, I was like, I know this feeling. Like, this is the feeling of when I would hold my baby skin to skin. It's this
Mm.
overwhelming feeling of love, this tangible kind of sensation that you feel in your body. That is the energy. And we can tap into this intuitively because this is our human nature. And simply what quantum touch does is it puts it into a really simple, easy to learn format so that you can learn it and then amplify it. Uh, So yeah, I went on to learn that. And then, I mean, long story short is I was then able to pivot to become a stay-at-home mom, and now I can offer quantum healing to other women, helping them with fertility, with any sort of women's health issues that they are having, and really helping them tune in and connect with their body so that they can access it too. Because it's not just about them coming to me and then I accessing that healing for them. It's I can show them how they are able to do this, and then they can create these miracles and these experiences within their own life.
That's beautiful.
Yeah.
I love that. And what really strikes me about it, in all honesty, is that you were doing the quantum touch healing for yourself without you even knowing what it was.
Hmm.
And you were creating everything that you wanted. Like
Hmm.
earlier in the conversation, you said you really wanted to be a stay-at-home mom. You
Hmm.
wanted to help other women be able to overcome their struggles
Hmm.
and, go through the journey in a better way. And this is everything that you went through led you to that.
Hmm.
And it's like we
Hmm.
spoke about earlier, it's like you're meant to go through what you're meant to go through.
Hmm.
And it's all about how you take it when you're going through that moment,
Hmm.
because how you act is everything.
Hmm.
If you don't act how you should, or, how we say how you should,
Hmm.
you can continue making those mistakes or you
Hmm.
can go down the wrong path. But if
Hmm.
you do what we say you should, you go down that path that really aligns with what your highest self wanted, what you had already signed up for to do while you're
Hmm.
here. And you allowed yourself to do it because you made the right choice. And
Hmm.
it's like the road less traveled, like I had another interview where I spoke about it with somebody. It's like, it's funny that that's such a poignant poem in life because so many of us do not choose the
Hmm.
road less traveled.
Hmm.
And as a result of
Hmm.
such, after 20 years in a career or what have you, we're like, what was it all
Hmm.
for? Like,
Hmm.
I feel so empty. Like, there's so much
Hmm.
more that I could have done, but I didn't.
Hmm.
And fortunately enough, because of where you were employed
Hmm.
and the journey that you personally went through, you were able to get to where you ultimately were supposed to get to. And you
Hmm.
did everything that
Hmm.
you were supposed to.
Hmm.
I
And it's
love it.
just about trusting, right? And the connection within. Like I said before, when I was going through those medicated cycles and I was getting the plan of how we were going to progress forward, physically, everything looked like it was lining up. And I had seen this story many times before with patients where it's like physically, it's like their blood work lines up, their follicles line up, everything on the ultrasound looks good, even down to IVF. Like it looked like we transferred a great embryo into a great spot in the uterus. So how it didn't implant, I don't know. I couldn't understand how if everything lines up physically, why is it still not happening? And then when I had my own experience, it's like, yes, physically everything lined up. But if I was being completely honest, internally, there was these mental, emotional battles that I couldn't even explain and couldn't even regulate. So that's what led me to know it's like, it doesn't really matter what's happening physically if it's such turmoil within. And that's what I needed to move through. But that is the energy work.
Yeah.
So when I can teach women how to regulate and move that energy within their body, then it just aligns. And it aligns in a way that we might not have even expected, which is so beautiful. And this is where we say it creates beautiful side effects and miracles. And miracles are just a normal byproduct of learning to listen within your body and to align with what you do want.
You're absolutely right. They're
Mhm.
not necessarily only something that should be associated with a spiritual or religious experience because we really are all capable of creating miracles
Mhm.
and we
Mhm.
are all capable of healing ourselves. We just
Mhm.
have to trust, we just have to
Mhm.
listen, and we have
Mhm.
to have faith. And, it's easier said than done, in all honesty,
Mhm.
because we're not we're not taught to tune in and
Mhm.
really take stock of our feelings and what we're feeling. Like you said,
Mhm.
if you were really being honest with yourself when everything was lining up medically and with your
Mhm.
levels and all of that,
Mhm.
you weren't sleeping, you
hmm
weren't emotionally in a,
hmm
dysregulated state. So you were out
hmm
of whack.
hmm
How was everything going to align as it
hmm
should be when your
hmm
inner, where that baby was going to be, where
hmm
that body needed to take hold and, rest for the next 9 months wasn't as it should be?
hmm
And
hmm
I love that you were in the fertility industry to go through this journey because it really did allow you to see what the experience is about.
hmm
And, I want to ask, is this something that you also bring to your motherhood journey as far as like the
hmm
energy healing? Like, I'm sure it probably helps so much
hmm
in the aspect of connecting with your children, even
hmm
in educating them about life. Because
hmm
for my own personal experience, like I can say, I probably spent a good portion of my life disconnected from my feelings
hmm
because I was never taught to check
hmm
in with my feelings and to realize the impact of them.
hmm
And I feel like what you're speaking about with the quantum touch energy healing is something that, you can really apply to everything in life, like you
hmm
spoke to.
hmm
And with children, I think it would be so
hmm
instrumental and
hmm
paramount.
Oh,
Can you speak to that
absolutely.
in any?
Yeah. And this is why when I work with clients, I encourage them to be students and to learn the workshop because this is a skill that they're going to use on a daily basis. Because not only is it going to help them get pregnant, it's going to help them be present during their pregnancy. It's going to help them through labor. It's going to help them postpartum, creating those connections with their children, those relationships. And I mean, I use the quantum healing on a daily basis for like cuts and bruises and scrapes, but also for bigger things of helping my kids understand and be present. But it's not even that. It's going through this experience has taught me to observe and to become aware because how I parent and mother now is different than I imagined I would have. My
Speak to that.
role now, I okay, let's say before I had my experience of struggling with fertility and becoming aware of energy, I thought my role as a mother was to control and to bring up and to shape these children. Like that is my role to produce these beautiful children that are going to do meaningful work, right? But I thought it was my job to make that. Now, the way I mother is I hold this space for them to grow and expand. They are born humans. They already have their mission, their plans, their meaning, their purpose, whatever you want to call that. They have
Yeah.
their path in this life, and I cannot control or influence that. And I'm going to try. There's been many times when I'm trying to like, coerce them into a
Yeah.
direction or influence them, but that just takes away from the beauty that they're here to create. So
Yeah.
I think of my job now as a mother as this creating this space, right? This fertile ground for them to grow into who they need to be. And controlling who they're going to be is not my job. And I had to learn that, which is fascinating because I didn't even think that would be something I would have to learn.
So how
So
did you learn
now,
it?
pardon?
How did you learn it? Was it just
Through
in going through the
experience.
journey? Okay.
Um, it was the whole, experience getting pregnant of like, I started with this trying to get pregnant in a very controlling way. Like I would tell my husband, I'm ovulating tonight, like we need to do it now. And from a very physical, logical way. And I realized that that didn't work. And the moment we just relaxed and we surrendered and we allowed ourselves to feel what we needed to feel. And I don't like to use a phrase, but almost like go with the flow. Like we were no longer trying to control it. We were just being present, that it just happened.
I
And
love
then
it.
all of these synchronicities just happened when I wasn't trying to force it. And then I would it would give me faith of like, okay, well, maybe I don't need to force it. Maybe I can just, let's see what happens. And then it would come about in a way that was more beautiful than I could have expected. And I started having those experiences, and then it taught me to just relax. And it taught me to just, let them grow and develop. And the same thing with children, like trying to tell a toddler what to do, you can't. I mean, obviously we hold this responsibility of, keeping them safe and holding that space for them. But ultimately they have this beauty within that needs to grow. And and I mean, I'm not saying like I'm still learning this. As my kids get older, it becomes more
Journey.
challenging because I want to tell them how to do something. And then if I give myself that just watch and see what's going to happen, oftentimes they come to a solution that is better than I could have expected. Or it brings up so much healing in myself because maybe they are pushing a chair to the counter and they're going to get into something. And I see, oh my gosh, they're going to get into the knives. I need to stop them. And I need to go in, I need to stop them. And if I just go in and stop them, then I don't know what they do. But honestly, it's not that they were even going to go for the knives. They wanted to grab something for me because they wanted to help me. Or they have such an innocence about what their actual intentions were. And if I can just let that play out, they do something so beautiful that I never would have expected. And I think that is so cool. Um, like I've seen my kids go for the scissors and right away I'm like, no, don't. And I'm like, oh, they're fixing something. And I was like, oh, I didn't know they were capable of doing that. And I mean, they surprise me all the time. So the more I have those experiences, it like heals that part of myself that needs to control. And okay, I can just trust. I can just
Yeah.
trust this is going to work out. And I mean, I've learned so much from them. Uh, so it's not even about, because even when I first learned quantum healing and I had my children, I'm like, I need to teach them this. They need to learn this. And I start and I realize they already know this.
Yep.
Like, I just need to not condition them. If I can just let them grow without putting my fears and beliefs onto them, I mean, it's very beautiful. So
Yes.
it's completely shifted the way we parent.
I love that. I absolutely love the experience that you've gone through. I love how you came to that knowing
Mhm.
and you allow yourself that grace. And it is allowing yourself that grace and also allowing them the grace.
So I just continue to hold that intention that I'm so grateful that I get to share this with women. And really, my driving mission is meaningful relationships. What is a
Mhm.
meaningful relationship, and how do we create and how do we experience and receive the beauty of a meaningful relationship? And that kind of is what guides me and steers me along this way. And with my children, with my husband, with my friends, that's my intention and where I place my energy into.
And it starts with being present in all
Mhm.
honesty, which
Mhm.
we are in this society, in the American society. I don't know how it is in Canada, but I feel that we are so constantly running and
Mhm.
disconnected from our
Mhm.
inner self. And
Mhm.
as a result of such, we're really not taking stock of the conversations worth having with people.
Mhm.
We're engaging, but we don't listen.
Mhm.
And sometimes when you're conversing with people, you'll really get it because they'll completely respond to something that you didn't even say.
Mhm.
And it's like, whoa, like, are we having a conversation here or are
Mhm.
you in
Mhm.
your phone?
Mhm.
And
Mhm.
unfortunately, technology and the cell
Mhm.
phones have really played a big part in that
Mhm.
disengagement because
Mhm.
now we have a constant
Mhm.
distraction.
Mhm.
Whereas, like 20 to 25 years ago, that constant distraction wasn't there as much,
Mhm.
I feel.
Mhm. Mhm.
So, it's
Mhm.
interesting. It definitely
Mhm.
is an interesting thing, but being present and
Mhm.
the relationships that you have are so
Mhm.
important.
Mhm.
And,
Mhm.
I've learned that so much in just like the past 10 years of my life. And it's made such a huge impact in how I move, in just how I live my life, because I live more with intent now.
Mhm.
And I am more present than I was. And I'm not perfect. I'm still working on it. It is a journey. But
Mhm. Mhm.
having that knowledge and that mindset in the back of
Mhm.
my mind
Mhm.
does make an impact in how I move and how I
Mhm.
choose to live my life.
Mhm. Mhm. Yeah.
So,
And I believe that's why collectively this is happening
yes.
because our bodies are always communicating with us. And our bodies know the pace at which we're living is not conducive to the beauty that we are to experience in life. And that's why I believe I had those fertility struggles, because that's what it took for me to slow down, tune in, listen to my body, and experience this to move forward with intention. And I believe that that's why it's happening with a lot of women. So it's like this gift, like our body is slowing us down so that we can tune in, listen, and then move forward with intention.
Which is really how we should be living our
Hmm.
lives. And we've
Hmm.
really gotten disengaged
Hmm.
from.
Hmm.
So
Hmm.
tell me, was it really after your struggles and your infertility issues that you figured out that conventional medicine and the medical industry was no longer for you? And that, doing things as a quantum energy healer and
Yeah.
working independently was the route for you?
Yeah, because I realized that there was no awareness of the mental or emotional turmoil in the symptom or the disease management, right? The medical system is very focused on the physical. And I noticed this because even when I worked in general ultrasound, I still did a lot of female pelvic ultrasounds, or even when I moved over into women's health. I would do so many female pelvic ultrasounds, and 80% of the time they'd be normal. But these women would come in and they would say they have pain or they have irregular periods or whatever their symptom is. And I would look for signs of that on the ultrasound in their physical body. And most times I couldn't find it. And I started wondering, like, what is happening? Like, I can feel the pain of these women. I believe them. There's something happening. But every time I look on the ultrasound, it's normal. And I know if I document it, I mean, it appears normal on ultrasound. So it's going to get documented as normal. It's going to get sent back to the doctor, and their doctor's going to tell them, oh, it's normal. There's nothing wrong with you. But I'm like, what is happening? Because I could feel what they were feeling, right? And this is the emotions, this is the energy. I could feel that there were these blockages, but they hadn't shown up on the physical yet. So I started to understand that there was some sort of connection that wasn't showing up on the physical until it got, what's the word, like strong enough, big enough. Then it would start to show up in the physical. So I kind of had this awareness, even though I didn't understand what it was, until I started learning the energy work. And I was like, wait a minute, I've been feeling this. This makes a lot more sense. Because there was this section of time, maybe about 9 months, where I had learned quantum touch, maybe a bit longer than that, maybe about a year, where I had learned quantum touch and I was still working in ultrasound. So I was kind of doing both. And I would start running the energy just as my patients came into the room. Because oftentimes when patients are coming in for an ultrasound, there's anxiety. They're anxious. They don't know what's happening. They're scared it's going to be terrible, right? They're scared it's going to be like an aggressive cancer or like wherever their worst case scenario thoughts are going. So there's normally a lot of anxiety involved. So I could feel this anxiety when the patient would come into the room. So as I was running the ultrasound, I would also be running the energy, and I could just feel the room kind of like soften and like peace enter, and the women would like melt, and sometimes they would cry, and sometimes they would share story, and I could feel the shift. And that's when I really started to realize, oh, this is real. There's something here. But then that coincided with I was pregnant with my third, with my daughter, and then I knew I was going to go on to my mat leave. And I wasn't planning to return back to work after that point. At that point, my husband and I kind of were able to rework our life so that we weren't dependent on my ultrasound income. And then that's when I was able to promote a little bit more time towards the quantum energy healing and helping women while also being a stay-at-home mom. But I mean, the way life goes, then we also decided to start homeschooling. So I get to homeschool my kids too. So it's almost created this entirely different lifestyle, which is really beautiful.
I
Uh,
love that. And, I want to expand upon the running of the energy when the patients are entering the room and you're starting to do your ultrasound work. Run me through that. And, it's funny because
yeah,
you run the energy, but
yeah,
what does that look like? And is it something that you let the patient in on or no?
right. So it depends. Essentially, when you learn this the skill of quantum touch. And as we say, run the energy. It's similar to having a prayer, praying for someone, right? You can be driving down the street and you can be praying for someone, right? So you can do two things simultaneously. So the same thing happens once you understand how to run the energy, use your body as a catalyst to bring energy in, then you can do it alongside whatever else you're doing. And a lot of times there are practitioners like massage therapists. I've taught to osteopaths. I've even taught to doctors and nurses, and they've been able to run the energy when they're with clients as well. So it can complement whatever modality you're currently in as a way of really elevating and supporting your patient and your client.
I think the key component in that is that you have to be open to that because and I hate to take it to religion, but it's something that I've noticed my family has always done. Like whenever we leave the house or when we get in the car before we get on the road, a little prayer is said for protection and guidance.
Mhm.
And I've heard individuals that are like mediums or channelers talk about that, the fact that they do a prayer. And I've also started hearing more individuals, not as much, but I love that you said individuals in the medical profession do
Mhm.
also do that because you hear it less often
Mhm.
because not as many medical practitioners are having these type of conversations. More
Mhm.
so the individuals that have left traditional
Mhm.
practices and
Mhm.
are speaking out about the different things that they're doing, like
Mhm.
the sack bushes and
Mhm.
individuals like that.
Mhm.
But you it is about checking in and putting yourself in the right space and
Mhm.
preparing yourself to do your very best
Mhm.
as you can for
Mhm.
that individual that you're
Mhm.
working with in that moment.
Mhm.
So thank you. I appreciate
Mhm.
you letting me know what that process looks like. And
Mhm.
it's something that we can all do in
Mhm.
any moment in life
Mhm.
to
Mhm.
help us just get ourselves aligned right so
Mhm.
that we're able to do whatever it is that we're
Mhm.
about to do
Mhm.
from the highest state that we can
Mhm.
do it.
Mhm.
So
Yeah.
I love that. And was the journey difficult for you to get yourself established as an energy healer and a fertility specialist? Or probably not, I would assume, because you had your own testimonial, you had
Yeah.
your own experience from
Mhm.
being in that industry. So you were probably like somebody that
Mhm.
individuals flocked to
Mhm.
once they found you,
Mhm.
because one thing I was going to ask is while you were going through your struggles, like you said, you had a benefit because you were working in that industry.
Mhm.
But were there other individuals that you were able to find that were tapping into modalities that you eventually tapped into? And that were, having those type of conversations with women about other things that they can do with regards to their fertility struggles, or not really?
Not really. Not when I worked with infertility. But I started having experiences with my patients for sure. Like there was
Okay.
one woman I remember, and I don't remember exactly when in my journey I met her, but she was an IVF patient at our clinic, and she had gotten pregnant, and it was a journey for her to get pregnant. And by the time she got pregnant, we were all so grateful. We were all so happy for her. And then we noticed that she started coming in and the outcome wasn't looking favorable. And then we ended up scanning her as she miscarried as well. And I remember I went to scan her post miscarriage because they wanted to make sure that the body had released all the tissues. And when she came into the room, of course, it's really emotional at this point because you've been with these women. I've been with her for the past months as she
Yeah.
went on this journey. And she's like, Thea, I'm pretty sure everything is passed. And I was like, okay, well, let's just have a check. We got to document it. And as I was scanning her, she told me this story that she was at a friend's house and she had told her friend what was happening. And her friend's like, my horse has healing abilities. Why don't you come down, spend some time with the horse, and the horse can help you move through your miscarriage. And she said that she was just petting the horse and the horse was being so sweet. And in that moment, she felt like a blop, as if
Mm.
everything within her just like fell out. into her underwear. So she could feel that her body just released as she was petting this horse. So then
Wow.
she said she brought herself back up to the house and she got herself cleaned up. So she was pretty confident that everything had been released. So then she came in for the ultrasound. And as I'm scanning her, I'm like, yes, it confirms that everything has been released. It looks empty. Uh, and I just thought that was a really beautiful story because I hadn't heard that before. So it was interesting that this patient had shared that. Um, and there was another woman where I had already learned quantum touch and I was already certified as a practitioner. So I started sending with clients kind of on the side, but I was at work and I was maybe 6 months pregnant with my daughter at that point. So I was visibly pregnant. And it's always really, you really have to navigate when you're pregnant and you are now bringing in an infertility patient,
Yeah.
or someone who's going through a miscarriage, right? And oftentimes it's kind of like an unknown rule amongst the ultrasound techs is that the super pregnant ultrasound tech does not scan the women who are miscarrying or going
Yeah.
through IVF, just
Kind of like
because
bad
that's
taste.
the kind thing to do, right?
Yeah.
But the way the patients fell that afternoon, I was the only one left, and I didn't really want to scan this woman because the requisition said rule out miscarriage. And I was like, well, so I try to wear my baggy lab coat and just not look super pregnant. But I
Poor
bring her back
thing.
into the room and she looks at me and she's like, you scanned my last miscarriage. And I was like, oh, okay. And I'm like trying to be, emotionally supportive for this experience. And I get her onto the table and I start scanning her. And I realized that her history was she had had 12 miscarriages. And this
Oh
was the
my
12th one.
God.
And she's worked with 3 different fertility clinics, ours included. And she hadn't been able to carry a baby past 6 weeks. And I'm scanning her, and it looks like she had already miscarried and that her body had released all the tissue. And I'm just finishing up the ultrasound and I'm running the energy and I'm just holding the vision that she is, carrying this beautiful child, enjoying growing, raising this family, spending time with her baby, like really holding this vision for her. And we got into such a meaningful conversation. And I started sharing about my own miscarriages and my own experience. And I just shared my own journey with her. And by the end of the ultrasound, it was just such a beautiful experience. I don't know how else to explain it. Like, when you just feel that peace,
Hmm.
and we could both feel that. And I said goodbye, I wished her well, and she left. And a couple months later, I see her, maybe it would have been a month later, I see her on the schedule, and she was expecting. And it was a first trimester ultrasound. And one of my friends had scanned her and everything looked great. And I met her in the hallway as she was leaving and she gave me a hug and she's like, I feel amazing. And then she left. And then I saw her come back for her 12-week ultrasound. And once again, another tech scanned her and I met her in the hallway as she was done her ultrasound and she gave me a big hug. And I was like, congratulations, because now this is the first time she was able to carry a pregnancy to 12
That's the
weeks.
6 weeks.
And then I saw her on the schedule again at the 20-week ultrasound. But at that point, I didn't meet her in the hall. And I must have got my timings a bit wrong because I met her at the 20-week ultrasound, but then I was about to start my mat leave. So I never did hear how she had gone past that. But it was pretty exciting to hear that she was able to carry this baby to 20 weeks naturally. Like she didn't go back to one of the fertility clinics afterwards. This was just a natural pregnancy, and her body was naturally able to carry it to 20 weeks. So it was really beautiful.
That's awesome. And I'm absolutely certain that the conversation that you had with her and whatever energy work you did during that
Mhm.
time had
Mhm.
taken hold of her. And
Mhm.
even the session that she had with the horse prior,
Mhm.
she was already open and in a different space herself,
Mhm.
so that her body was able to create the home for
Mhm.
that baby to come in and, continue growing and hopefully come to a successful birth and everything. But
Mhm.
that's beautiful. I love that.
Mhm. Mhm.
I really love the journey that you've been through, the experiences,
Mhm.
and everything that you've been fortunate enough to go through. And,
Mhm.
I'm sure you've helped thousands of people at this point. How
Mhm.
many years has it been now that you've been doing this work?
Mhm. Probably about 5 years.
5 years?
Yeah.
Okay. That's awesome.
Yeah.
Now, would you say that mindset really plays a huge part in it all?
Oh, absolutely. Mindset and belief, because that is your intention, right? Whether you
Yep.
believe that or not, or whether you're aware of that or not. I mean, you can even just simply look to common phrases within the infertility realm, right? Trying to conceive. I mean, if you are trying to conceive, you are going to continuously perpetuate a state in which you're trying to conceive. And that's not
Yeah.
the intention that we want, right? We want to be able to feel pregnant, right? Feel the gratitude of holding that child, seeing that vision. And oftentimes, when we're struggling with infertility, we're not able to hold that vision because we'll be triggered by something, or we'll say that that's not possible for us, or whatever resistance is coming up to that image of holding your child, that is pointing to the energy that needs to be cleared and released. So the moment you can hold that belief that it's possible, and I experienced this with myself. I was trying to conceive. I was doing everything I would have learned in the fertility world to conceive. And the moment I just surrendered and I was like, I'm just going to trust that we will have our children when we're meant to have our children. And I'm so grateful for when the moment is that we get to hold our children. But right now, I'm just going to do me. And I'm just going to trust that it's going to happen. And I really had to shift my belief. Another common belief amongst the fertility world is not wanting to be around pregnant women. And just like I had shared before, the pregnant ultrasound tech is not the one that's going to scan the miscarriages and the IVF if we can help it, because you just don't, right? We cater to that. But the truth is the moment you can look at a pregnant woman and feel comfortable around her and look, for me, I had to shift it from, I realized that some of these women who were pregnant had struggled with fertility for years. So suddenly, the pregnant woman was not an image of something that's not possible for me, but an image of someone who was able to overcome whatever that challenge was
Yeah.
and get pregnant. So
Hope.
then I started to see the pregnant woman as, if it was possible for her, it's possible for me. And
Yeah.
then I was able to go to my friends' baby showers because I had friends getting pregnant before I was getting pregnant. Or I got pregnant at the same time as them, but then I miscarried and they didn't. And then I'm going to their baby shower. And of course, filled with grief that, well, my baby's not coming,
Right.
right? And I would try to avoid those situations. But that really, when you start to avoid those situations, as painful as it is, you're really just catering to that belief that it's not possible for yourself. So the moment you can heal whatever it is that is telling you it's not possible for yourself and feel that gratitude and hold that space being safe around pregnant women, the energy shifts. Uh,
Completely.
so absolutely. So I mean, that's where I start with women is, well, where is the pain? Like, what is the part that really hurts? And what is it that you want? And why is it that you feel you can't have it? And then that's where we start running the energy to.
Mm.
Mhm.
It's deep. That's really deep. It's like you're a therapist in all honesty,
Yeah.
you know? And it's interesting. Like I do hear more individuals in that profession expanding their wealth of knowledge
Mhm.
because information like what you're bringing to the forefront is such a paramount thing in the
Mhm.
treatment of
Mhm.
an individual. So I know that you also do some work with meditation as
Mhm.
well.
Mhm.
So tell me, how do meditation and any energy work complement the physical treatments for infertility?
Mhm. Absolutely. And they all work together.
Okay.
So I like to say meditation is becoming aware, right? Can we be present? We become aware. So we become aware of what that trapped energy is with meditation, and then we can heal it with the energy healing.
Gotcha.
So we use meditation as a daily practice to become aware, and then we can bring the energy healing in to address those areas that are coming up. So the practice that I've created is called Breathing Beauties, and it's a 28-day practice of creating, and it's essentially the practice of meditation with the essence of energy healing, so that you are learning how to create a daily energy practice that is going to support you when triggers come up. The purpose is having a practice that is going to create the foundation of a skill you can draw on when times are tough. Because in
Yeah.
the morning, you could have your meditation practice, things feel great, and then you go to the store and you run into a pregnant woman and you panic.
Yeah.
So then you can, something is coming up, right? It's coming up to your attention. And then you become aware of that and you can bring in this healing modality in the moment to
Breathing.
help you move through that situation. Because
Yes.
situations like that are just going to come up and we
Yeah.
can't control it. So it's about creating a practice where you now have a tool to create that regulation to bring your body into ease when that comes up in the moment.
I love that. And it's so applicable to everything in life, not only
Yeah.
infertility, because you're
Yeah.
right, things are going to come up in life,
Mhm.
but it's all about how we deal with those
Mhm.
emotions and those
Mhm.
triggers.
Mhm.
And like I mentioned earlier, are we going to allow them to control us throughout
Mhm.
life, or are we
Mhm.
going to learn
Mhm.
from them
Mhm.
and let them be our guides to
Mhm.
help us continue growing
Mhm.
throughout life?
Yeah.
Because they really are indicators of so much, in all honesty.
Yeah.
And we really don't we really don't check in with ourselves
Yeah.
at all.
And bringing it back to your question about how can we implement that in with treatment or doctors or appointments or whatever else you have going on, absolutely it can complement it. So when you start to hold this daily practice with this intention of being pregnant, with your growing, thriving family, you're going to find that you're drawn to the practitioners who are going to help you. And it's going to amplify whatever sort of physical services you are accessing. Right? Maybe suddenly you'll become aware of this new technology or this new treatment, or your partner is going to become aware of something and it's going to be led down the right path. And it's kind of like you suddenly align with the path that is meant for you. So it doesn't have to replace whatever treatment you're wanting to do or that path. It's going to align you with the one that's for your greatest and highest good. And then it also gives you um, a tool to help you through that too. Because a lot of times these practices or procedures you can feel anxious going into them or you're
Yeah,
unsure, right? So you can use practices like meditation and energy healing to help you through the other practices and treatments that you are going to go through, right? So it really can
absolutely.
complement and amplify whatever path you have chosen.
I love that. Just like how you run the energy
Mhm.
before you work with somebody, or how a
Mhm.
doctor would do that before they
Mhm.
do a surgery. So
Mhm.
I love it.
Mhm.
So
Mhm.
tell me, Thea, are there any myths about infertility that you would like to just put to bed and get them out of women's minds? Because I'm sure there's plenty of them out there.
Yeah. Yeah. I think the biggest one is we can't make ourselves pregnant. We receive children.
Mm,
There's this idea that we can control it and we can conceive and we create the conception, which I mean, it kind of depending on your language there, but I truly believe that we receive the children we are meant to receive. And it's going to happen when is for the greatest and highest good of the child. So it's
I
not
agree.
about our timeline, it's about connecting with that child and co-creating with them. It's really interesting when you start to hear children say, I chose my mommy, I chose my daddy, or there is something miraculously happening. And I didn't have that level of awareness before I got pregnant. This is the other thing. You don't have to be fully healed to get pregnant. I like look back and I'm like, man, I wish I would have known that, but I didn't. And you get to learn it, and the rate at which you learn it is your own, and it's
Yep.
beautiful because I help women now connect with the soul of their child before they even conceive, which is such a beautiful experience, and it's so possible, and it's so much easier than people realize. Like it really is possible to create that connection, but I never experienced that with my children. But now my daughter, independently, because I don't talk like this about them because I always want to observe kind of what they're saying. But my daughter has said many times that she chose me and she was happy that she chose me. And
Wow.
it just is part of her conversation, right? Like she'll talk about playing with her doll, with coloring. I'm so glad I chose you, mommy. Can we have toast for breakfast? Like it's just a nonchalant comment.
Mhm.
Uh, and I listen to other kids, and kids will say stuff like this. And
Yes.
it's not like it's a big dramatic conversation. It's just a sentence that they say.
Simple. Yeah.
So I truly believe that we receive our children, and then we can just, as a woman wanting to get pregnant, can simply relax into that. So I believe the moment you feel you want to be a mother, that's that first point of connection with the soul of your child. And then it's just about relaxing, developing that communication, that conversation through your body with their soul, and then it will guide you.
through
So
the
when you
journey.
talk about this knowing, and then I think back, okay, so when I was struggling to get pregnant and I had my miscarriages and I was going to go through more treatment and I decided not to. And I had this knowing that it was going to work out. I was like, where did that knowing come from? Was that a communication message from my child that, yes, it's going to happen, mommy? And was his soul guiding me in those steps that led to his conception?
Hmm.
So I don't know. Who knows? But there is just so much beauty and miracles in the process. And I just encourage women to explore that because you get to experience that and it is so beautiful. And then you get to experience that peace and that joy, and it really changes your whole experience.
It's phenomenal. I
Mhm.
love the stories and I love the journey that you've been through. And, I've heard many people, especially within like the past 5 years, that conversation of children saying, I chose my parent and
Mhm.
what have you, is starting to be more topic of conversation.
Mhm.
I think it's a beautiful thing. And you're absolutely right. If you're not in the right place and you don't allow yourself to connect to that, you're not going to make that connection. And that's
Mhm.
probably the first blockage that so many people have. And like I said earlier, so many of us are disengaged and disconnected from ourselves that so many blockages
Mhm.
do exist.
Mhm.
So meditation is absolutely a great way to
Mhm.
start working on those blockages
Mhm.
and to start being able to be more present with
Mhm.
yourself and with
Mhm.
the other individuals in which you
Mhm.
interact with. You spoke about the Breathing Beauties.
Mhm.
I saw that on your website.
Mhm.
What other things do you offer on your website? And what is your website when people can
Mhm.
go check you
Mhm.
out, find out more about
Mhm.
what you offer, and connect with you and your services?
Absolutely. So my website is theawillette.com, and you can find me on socials at Thea Willette too. So I'm on Instagram. There are some meditations on YouTube, and there are also some meditations on Insight Timer. And I do some lives on Insight Timer, so you can check that out as well. But on my website, you can be directed to Breathing Beauties, which is a 28-day meditation practice with the goal of creating this daily energy healing practice in a meditative form. So it's really beautiful. Each day, it's a guided audio sent to your email that kind of builds on it so that by the end of the 28 days, you've created a daily practice that you can just continue to do. So you don't need a tool to help you with that. And then I offer a package called the Supported Mama Package, and it includes 5 one-on-one sessions with me, 2 access spots to the Quantum Touch Level 1 workshop. So you can either use both for yourself to experience the workshop twice, or you can give one to a partner so you can learn it together, as well as you get access to the Breathing Beauties meditation practice and energy healing for women video series so you can learn how to do all this work yourself, because it's not just about coming to me, it's about you understanding how you can access these tools and create this foundation for yourself. The other beauty about the 28 days is it aligns with our cycle. And you
Mm,
start to create this connection with your cycle, with the moon, with it. It's this really beautiful experience. So it really is a way of connecting in with your body.
I love that. Wow. We
Mhm.
really are
Mhm.
cyclical
Mhm.
animals, just like,
Mhm.
the animals
Mhm.
outside, and we're so disconnected.
Absolutely. Yeah. And learning to connect with your cycle can bring so much wisdom, and it totally
Yes.
changes the perspective of your cycle, that each cycle is another, I guess, round of deepening this wisdom within your body, and it can totally shift your perspective. Yeah, your experience. I was the same way. Even though I worked in ultrasound and we're always talking about, cycle day, whatever, because it coincides with what it looks physically on the ultrasound, I never took really note of those cyclical changes until I finished nursing my daughter and I had gotten my period back. And I started tracking it and I realized I would track day for day with the lunar cycle. Like I would
Wow.
track with the full moon or the new moon. And then what would happen would be suddenly my periods would get really short. And they would be short until I have changed the sync. And now I sync. So say I was cycling with the full moon and then everything would be 28 days, bang on. And then suddenly my cycles would get really short until I would cycle with the new moon. And then I would be consistently 28. So it's like, yes, my cycles were inconsistent, but they were consistent with tracking with the moon,
Right.
which I thought was fascinating because how many times do we as women have irregular length of periods and we think that that's
Yes.
wrong when actually I believe that was by design
Yep.
because there's deeper wisdom that's coming up. Anyways, that's like a whole nother aside, but I think it's just this beautiful example of just learning to become aware and just
Yes.
observing and just noticing what is the beauty and wisdom that your body is expressing.
Absolutely. And,
Mhm.
that's a perfect note to end on. And you touched upon it perfectly. Like, that's a whole nother topic. And that being said, we're going to have a whole nother conversation with you, Thea, because there's so much more that we can talk to you about. And I'm also going to ask you if, hopefully, if you have some time, maybe you can afford us the luxury of having one of your meditations be a
Mhm.
part of our YouTube channel, or maybe you
Mhm.
could lead one of the equinox meditations
Mhm.
that we have.
Mhm.
And I just look forward to connecting with you more. And I thank you for joining the People's Health Alliance of North America member directory.
Mhm.
And I look forward to connecting with you further and working with you. And I thank you for your time today. I appreciate you sharing your journey and what you have to offer to women. It's not only to women because, our partners can also benefit
Mhm.
from it.
Mhm.
So if anything you heard on this conversation touched your heart or was near and dear to you, please don't hesitate. Reach out to Thea, or you can check us out on the People's Health Alliance of North America website and find out Thea's information as well. But like she said, she's on social, theawillette.com. You can find her by that name. And she's also in our membership directory. So thank you so much, Thea. It was a pleasure speaking with you, and I look forward to doing it again.
You're so welcome, Denise. Thank you so much and for having me on with the People's Health Alliance.
Absolutely. It was a pleasure. Take care. Have a wonderful
Bye.
day.